myself Anil Kumar, Senior Tutor, School of Nursing, Sanskriti University. Now I discuss Guillain-Barré Syndrome. My topic, let's see, start a definition of Guillain-Barré Syndrome. So what is a Guillain-Barré Syndrome? Guillain-Barré Syndrome is a autoimmune disorders. This is condition in which your immune system attacks. The Guillain-Barré syndrome is attacked of immune system, nervous system, and your peripheral nerves, and it's lead to symptoms like numbness and tinglings, and muscles weakness that can progress to paralysis. The Guillain-Barré syndromes cause paralysis, partially and completely paralysis. But with the treatment, most people fully recover of the most conditions due to treatment. Next, types of GBS. टाइप्स ऑफ जीबीएस में फर्स्ट टाइप है एक्यूट इन्फ्लामेटरी डाइमेथिलेटिंग पॉलीन्यूरोपैथी AIDP. First symptoms of AIDP: weakness and droopness of on side of face. Next, slow or absent reflexes. Slow and absent reflexes, it means our reflexes movements are very slow. Difficulty with speaking, swallowing or moving eye and tongue. Difficulty just like swallowing. Any food particles take very slow and painful. Speaking, very difficulty speaking and moving. My position, your patient positions are moving, very difficulty, not able to walking and not pronouncing, do not move a tongue properly. Next, tingling, burning and pain in the skin. The sensation is like a tingling sensations, just like a needle stick. Every puncture feel a pain like it. Next one, automotor sensory axonal neuropathy. This numbness and tingling in the feet and hands. Just like tingling sign is a likely needle punctures to started feet and hands. Next, problems with the automatic process such as a breathing. It is painful to breathing and respiration. Next, weakness and lack of muscles control in all limbs. All limbs are sluggy and completely weakness and paralytic conditions. Next, acute motor axonal neuropathy, the dizziness and fainting, sexual dysfunction and urinary problems, urinary retentions, incontinence of urination, problems digesting food, alimentary canals is disturbed, and slow pupils reactions, eye pupils relaxations and very slow movement. Symptoms of Guillain-Barré syndrome. Guillain-Barré syndromes affected your peripheral nerves which control muscles movement, just like leg muscles and deep muscles, and then hand muscles are involved for Guillain-Barré syndromes affected. And pain signals and temperatures and touch sensation is very slow. Thus, GBS cause issues related to these functions. The first symptoms of Guillain-Barré syndromes are muscles weakness and or tingling sensation. Tingling sensation is a painful conditions like a needle puncturing, and paresthesia. Paresthesia is a multiple needles pricking in the hand or legs. that feel a pain is paresthesia. These symptoms typically comes on suddenly. These symptoms are very typically and comes at a suddenly or a weeks. They usually affected both sides of your body and start in your feet and legs. Firstly, these symptoms start from the feet, and after that, this conditions is more than transmissible or movable to hand and neck or face. Muscles weakness in your legs many make a difficulty to walking or limb strength. The Guillain-Barré syndrome is complicated to leg for difficulty in walking and leg muscles. This severity of GBS can range from the very mild to severe. It started to mild condition and moderate than severe. Depending on the severity of the condition, our symptoms may include first, deep muscles pain in your back and legs. Deep muscles, it means calf muscles, leg and hand. Both muscles are stress and painful conditions. Paralysis of your legs, arm and facial muscles. Paralysis condition are both and same, and some conditions partially and some conditions are completely paralysis seen. Severe say, severe cases you may experience nearest total and paralysis. Na? Chest muscles weakness. Chest muscles weakness is a respiratory difficulty conditions. While can we make a difficulty to breathe, this affect about a 1 into 3 peoples with a GBS. Difficulty speaking and swallowing, dysphagia. Dysphagia like a swallowing problems. Any food particle take, but due to GBS not to able to take and eat. Difficulty moving your eyes and vision issues. GBS make a condition to vision difficulty, vision problems and blurred vision. Complication of Guillain-Barré syndrome. Many type of complications are generated to Guillain-Barré syndrome if GBS affected your autonomic nervous system. Firstly, GBS affected autonomic nervous system. It can lead to life-threatening complications, just like a paralysis condition and lung effect due to respiratory failure, and autonomic nervous system affected to autonomic working organs, just like a heart and respiration systems. This condition automatic functional to your body that need to survive, like your heart rate and blood pressure and digestion. These both are affected to GBS. When you have issues with this system, it's called dysautonomia. This is called to dysautonomia because complication due to GBS related dysautonomia can included cardiac dysarrhythmias. Cardiac dysarrhythmias like bradycardia, tachycardia and unstable blood pressure, low blood pressure, high side blood pressure, digestion issues, gastrointestinal statuses, just like a SIO, subacute obstruction in the intestine. Bladder uncontrol issues like a urinary retention, just like bladder retention. Cause of Guillain-Barré syndromes. First cause, post infections. Post infections like after any infections cause Guillain-Barré syndromes. The condition typically develops after you have had some type of infections, just like any type of infections and respiratory infections. Some few days started a COVID-19. After that, the patient not able to take a proper breath. The condition typically develops after you had some type of infections. In up to 70% people who had GBS, their symptoms started one of the 6 week of an illness. Every illness, after the illness starting week or after 6 week, it can see and see a symptoms of GBS. Researchers don't know why GBS affected some pupils after they get sick and not others. Second, immune medicated. Immune medicated like a vaccination. An immune medicated condition result from a abnormal immune system response. Those conditions are immune depressants, just like a autoimmune disorder or immune suppressant, COVID-19, tuberculosis, and other conditions. For some pupils, after they get sick, their immune system responds abnormally and attack and damage their peripheral nervous system. Peripheral nervous system is leading to GBS. This is another way to saying it can autoimmune conditions. Autoimmune condition can generated by immunodeficiency. But unlike most autoimmune conditions, GBS is not chronic or lifelong. Third, neuropathy. Neuropathy is a umbrella terms of conditions that damage your nerve. In the case of GBS, its peripheral nerve, your immune system attacks your nerve rapidly over day and cause a loss of myelin. Guillain-Barré syndromes mainly affected to the myelin sheath. It can develop the neurons covering the status, the insulation of your nerve. Next, diarrhea or respiration infections. Diarrhea or respiration infections, about 2 in a 3 people with GBS had diarrhea or a respiratory infections week before developing GBS symptoms. Any patient had diarrhea and respiratory infections cause GBS. Infection which is the bacterial Campylobacteria jejuni, which cause diarrhea, is one of the most common trigger of GBS. Next, viral infections. Some people with the GBS have had the flu or like infections with cytomegalovirus, Epstein-Barr virus, and Zika virus or other viruses can cause viral infection and GBS. Vaccines. In a very rare cases, people have a developed GBS in the day or week after getting certain vaccines. It a improvement to know that the benefits of vaccination far between uh, otherwise waiting of the possibility risk situations, so that you have a greater chances of getting GBS after getting the flu than you do after getting a vaccination against to the flu. Next one is surgery. Very rarely cases of GBS developing after the surgery. Diagnosis and testing. Which diagnoses are included in the GBS diagnosis? Just like a healthcare providers typically diagnose a Guillain-Barré syndrome based on your symptoms and according to physical history and taking symptoms and signs of the patient. They'll ask how and where, whether symptoms are started. If you have been sick and recently, tell us. Also do physically and neurological examination to the patient for diagnose Guillain-Barré syndrome's disease. Look for sign in muscles and weakness. and weak or absence deep tendon reflexes. To check a tendon reflexes according to patient complications. And next diagnosis testing is a EMG, electromyography and nerve conduction velocity test, NCV. These is a test of evaluation of health and function of your skeletal muscles and the nerves that control them. It is checked to muscles strength. Then next, spinal tapping. Spinal tapping is the lumbar punctures. It can take for some fluids and take examination. For this procedure, your healthcare providers insert inserted needles into your lower back to get some sample of cerebrospinal fluid CSF. They send to sample for lab whether pathologist examination this substance in it. To take a cerebrospinal fluid with the spinal cord, and pathologist will examine these fluids. In about 80% of GBS cases, these are a normally amount of which blood cells and an evaluated CSF proteins level and other abnormalities in a CSF may point into other conditions. Imaging test. Imaging test, you are providing MRI, magnetic resonance imaging for a spine. Management and treatment. If you have a Guillain-Barré syndrome, you need to receive a medical care in a hospital in ICU, intensive care units. This is so your healthcare teams can monitoring you for any complications of GBS. Nurse observing your patients and take a patient physical conditions, vitals, monitorings to any changes and inform to higher authorities. Like a difficulty breathing or blood pressure fluctuations to inform a doctor, assigning consultant and another. The main treatment of GBS including one of two options. Which are the two options? First, plasma exchange, plasmapheresis. In this condition, in this treatment, a machine separated the plasma from your blood, treat it and then returns the plasma and blood to your body. It means change your plasma to another plasma and mix the blood. Plasma exchange filter out of the antibodies in your plasma that are attacking your nerves. Intravenous immunoglobulins therapy, IVIG, treated involve intravenous IV injections of immunoglobulin. It means immunoglobulin will be provided through IV injection of immunoglobulins, which are the proteins that your immune system naturally makes attack individually invading a organism. The immunoglobulin comes from a collection of thousands of healthy donors. IVIG can less your immune system attack on your nerves. Respiratory care. Respiratory care, if your GBS attack your muscles, your needs for breathing, you may needs mechanical ventilation. Just like every patient take a breathing difficulty to nurse provide a mechanical ventilations or venturi mask. Respiratory failure affected to 30% of people with GBS. Blood clot prevention are therapies of anticoagulant medications. You are provided may given a heparin and anticoagulant to help a prevention deep vein thrombosis due to muscles weakness. This can happen if you have a nearest total paralysis or in a medical bed for an extended period of time. Next, IV fluid and tube feeding. IV fluid and tube feeding will be started from the condition of difficulty in swallowing. If it is difficult to swallowing, you may need IV fluids and prevent to dehydration. And nasogastric tube feeding prevent for malnourished or malnutrition. These can also help prevent to aspiration pneumonia. Nursing management. Recognizing and assess signs and symptoms of Guillain-Barré syndromes to observing the patient conditions and symptoms, monitoring respiratory fluctuations, functions, and ensure adequate ventilation support if necessary. Provide supportive care and management pain and discomfort. Next, administrate immunoglobulins therapy and plasmapheresis as prescribed. Monitor and manage potential complications such as autoimmune dysfunctions or respiratory failure. Collaborate with the healthcare professionals to develop an individualized care plan of GBS. Faculties, physically therapy and rehabilitations, just like exercise, physiotherapies, etc. Optimize the functional recoveries, education patient and family to on the courses of GBS to advise the patient and family regarding to the treatment and exercises or etc. Expected recovery timeline and strength for managing and residual symptoms to the GBS. Offer emotional support and counseling of the patient and families during the recovery process to advise treatment therapies or physical therapies. Schedules regular follow-up appointment of monitoring progress and address any ongoing need to concerns. Thank you.